Beautiful. Good. So we're just releasing those ribs there. And there we go. What's up, everybody? Dr. Nick Nelson back here from Element Chiropractic Edmonton. I am here with Hayley Cross. She is from Flair Mortgage Group, and she's a badass at getting you a mortgage if you need one. She's been a patient here for a few months now. So she actually came into the clinic in the middle of the COVID shutdown. So when no clinics were accepting patients and we were taking emergencies, this was one of the emergency patients I had. So she's been coming regularly since then, so I'll let you speak with her and she can let you know what brought her here.
So the reason I came in, I was sleeping, I woke up, I couldn't move. My back was so sore. It progressively got worse over the next couple of days, so I called Nick and he was able to get me in and help me out. And over a couple sessions, it improved drastically, so it was really great that he was able to help me.
So since then, we got her back to normal, but she does work in an office, so sitting down quite often. We keep her in here on a consistent basis to make sure this does not happen again. So we've seen each other for a few months. This is going to be a pretty routine adjustment for her, but it'll give you a chance to see what we do on routine checkups to keep people healthy. We always just scan for tone at the beginning, checking what muscles are hypertonic, which areas seem to be stuck and rigid. And right in here, we can see there's some tension in the shoulders. So just try and relax those shoulders here. And take a big breath in and all the way out. There we go. So that office job does keep those shoulders pretty tight. It is something we always have to check in on. Now, the original area that she came in with an injury was actually in the lumbar spine right here. And it was a very specific area in the L4. And since we adjusted that the very first time, it has not been an issue. But we noticed on that first visit that there was a pattern that kind of went with it. And her hips have her own little pattern that set up the environment for this L4 to slip out. So what we're gonna do is we're gonna have her turn on her side with this side up. And I'm just going to straighten this out here. And the hips forward. Perfect. Perfect. And we're going to flip you to the other side as well.
Oh.
It's stuck. Beautiful. Now onto your back. And I'm having you just slide up the table a little bit so you're in the headpiece. There we go. So we're always checking at the leg length here to see how everything's feeling. Checking the hips in the front. Oftentimes we can adjust the back, but if the front of the hips is uneven or locked in place, we have to address that. It does look good today. So we're going to come around this side. Beautiful. So again, the upper back taking so much stress with that computer positioning and the forward head posture on the phone all the time. So we're just releasing those ribs there. Beautiful. Good. Neck's a little tight today, hey?
Oh yeah.
Yeah. So a little locked up. We're going to come in and we're going to pull that from this side. And there we go. A little bit of extra tension in the neck, so we're just going to put some distraction here. Let's just relax that head a bit. Good. Okay, so we always come and finish with the feet. We have so many different types of shoes we have to wear, and especially being a professional, Hayley's in some of the shoes that may not be the most comfortable all the time. So we're always trying to make sure that we keep all of these joints moving. Beautiful. So nice and simple. Come on up, we're all done.
Thank you.
All right. So thanks for joining us again at Element. So this is what a routine adjustment's going to look like when you've been in here for a little while. We're just going to scan the area, make sure that everything is moving on a day-to-day basis, because again, it's a lot easier to keep you healthy than fix a problem when it comes in. So we'll see you later. Catch you next time.
Thank you.